I'm here today with a special guest for our Facebook Live. This is Dr. Daniel Palma from the Women's College Hospital in Toronto. Daniel, thank you for being here today.
Yeah, nice to be here.
So we just have a few questions for you.
Sweet.
First, would you like to start off by just telling us a little bit about the Women's College Hospital and your role there?
Yeah, so Women's College Hospital is an ambulatory care center in Toronto. And essentially what that means is there's no inpatient beds. There's other kinds of health services offered there, family medicine, internal medicine clinics, mental health, and surgery, but only day surgery. So we don't keep patients for longer than a day, essentially. Right. And my role there has been that I'm doing a residency in general surgery, and there's an opportunity for me to do research during that residency. And so I'm doing a PhD in clinical epidemiology, the study of population diseases from a clinician's perspective, essentially. And through that work in graduate research, I became interested in actually studying virtual care and how to establish services using technology, and became involved in a lot of projects having to do with that at Women's College. And I've been doing that for 2 years there.
Awesome. And working there so far, what have some of your biggest challenges been?
I think challenges in the tech implementation projects I've participated in have been mainly to do with adoption. And what I mean by that is really the interaction between human teams and the technology itself. Things that obviously make that challenge a little easier to navigate are related to the platform and the usability of the platform, but also the receptiveness of the clinical team to actually work in new ways. I'll just give you a quick example. At Women's College, we actually established a new workflow that had never been done before in a relatively short amount of time to actually achieve pretty record results, which we're going to get into. But the point being that, that was a big win, and that was really a big win because we were able to get over the adoption challenge.
Great. And you also use aTouchAway at the Women's College Hospital. How did you get involved with Aetonix?
So I've been evaluating Aetonix now on 2 separate projects. And it's really through my research at Women's College that I came to know you guys. Essentially, I expressed an interest early on in my research career that I wanted to evaluate virtual care services. One of my committee members let me know about the HTF evaluation that was going on in Arn Prior in Winchester at the time, and needed some clinical leadership. And so I stepped in and was able to participate on that project, observed how the technology was being used, how video conferencing was really beneficial, and thought to myself that a similar application in surgery would definitely fly. And so began talks about incorporating Aetonix into that pilot project at Women's College to do same-day discharge for knee replacements. So I've been kind of working with your company and evaluating the services for about 2 years now.
Perfect. And how have the patients at the Women's College Hospital been liking the app so far?
Patients really have responded to actually very positively. I think they really like the reassurance they get from actually being able to have a question and then quickly have an interaction with someone, have that face-to-face where you can actually look at people's eyes, kind of get a sense, and then really be able to trust that answer. I think that's the kind of interaction that would, save people from coming to the emerge or, maybe doing something that isn't necessarily according to the protocol. I think it's much better that they can actually ask, get a quick answer, and then be able to course adjust in order to get a better recovery out of it. People really like it.
Sure, awesome. And obviously there's concerns if patients are being discharged within the same day of their surgery that they may feel abandoned or that they may not have that same support if they're recovering at home. Do you believe this is true?
No, I mean, a big part of why this works is patient selection. We really pick people that are motivated and want to participate in this kind of service. But aside from that, what I would like to say is the service that we offer using virtual care is actually different than what you get in a surgical ward. And it's a lot more social. There's a lot more interaction with your clinical team. And people have often said it feels a lot less like, me filling out surveys or having like a techie experience. And it feels a lot more like having someone visit your home. And I think that is one of the biggest myths that I would like to kind of bust, I guess, is that, virtual care related services, if done well, are actually better able to connect patients to their care team rather than, less.
Yeah, definitely. And what do you and the patients think the differences of using a telehealth solution like aTouchAway has been so far?
Oh, the difference, I guess, for patients has been really the connection to the care team. I think that is one of the main features that people have said of the patients that I've worked with personally on this latest pilot. many of them have actually been in hospital before. So they know what it's like to kind of have a surgery. They know what it's like to recover in the hospital. And they've told me that the big difference is that they feel a lot more in control. They know what medications they're taking, why they're taking them. They feel like they have an active choice as to what they put into their bodies. And in fact, we've been able to actually reduce a lot of the opioids that people take just because we're able to provide that reassuring touch. And that's something that people don't normally experience. Like, you know, someone that cares about how much medication they're taking, for instance, like that's not necessarily something that a lot of health systems emphasize. And I feel like this platform definitely could.
Awesome. And on that note, what do you see for the future of Aetonix and aTouchAway?
I think the near-term future for platforms like Aetonix are really to focus on providing really great patient experiences for short episodes of care. What I mean by that is things like surgery, things like, you know, knee scopes, like rehab-related things. I think when people have a clear sense of like there's like a time in which I'm healing, a time in which it's really relevant for me to talk to my care providers like frequently, I think a platform like Aetonix is amazing. And there's tons of opportunity in the health system to provide episodic care through something like virtual care with a platform like this.
Definitely. Well, thank you so much for joining us today.
My pleasure.
It was great to have you, and thank you everyone for watching. We hope you have a great day.
Take care. Bye-bye.